Every single day, a precious life leaves this world unexpectedly. A person who, just yesterday, seemed perfectly healthy, simply vanishes forever. And it makes me wonder, are you right now feeling something a little strange? A little off? Perhaps some trouble with digestion, a nagging ache in your back, or a persistent lack of energy? Welcome, my friends. Professor Vitalis here with your daily dose of wisdom and wellness, where science and experience walk hand in hand. In my 45 years of practice, I have seen countless patients, but the most painful thing for me, the one question that has echoed in my ears again and again, is the sound of absolute despair. Doctor, they ask, if I had only come sooner, could I have survived? It is a question that haunts me. It's difficult to accept, but pancreatic cancer is a silent stalker. More than 90% of people who receive this diagnosis find out far too late. But please, do not despair. Over these decades, I've uncovered a crucial secret. Your body sends out 5 incredibly subtle warning signals, whispers from your pancreas. If you learn to listen for them, this disease can be defeated. That is why it is absolutely vital that you stay with me until the very end of this video. Because after I explain these 5 overlooked signs, I will share the specific, advanced screening methods that can detect this illness at its earliest, most treatable stage. Knowledge that could very well protect your life or the life of someone you love. Right now, at this very moment, thousands of people are experiencing these signals without even knowing it. Tragically, most will simply write them off as a sign of getting older or perhaps just a bit of indigestion. It pains me to see people miss the chance to prevent a tragedy that could have been stopped with just a little more attention. Today, I'm going to share with you knowledge that you won't find in any standard medical textbook. This is wisdom earned through years of clinical practice. If you think this is all nonsense, I implore you, just give me your time and listen to the end. Later may be too late. The first key signal is a change in your body's temperature regulation. When the pancreas is in trouble, your internal thermostat begins to malfunction. What is especially characteristic is a combination of feeling icy cold in your hands and feet, while at the same time experiencing a sensation of heat or a flush in your face and neck. If symptoms like this continue for more than 3 weeks, you absolutely must get an examination. Now, many people dismiss this as poor circulation or just a quirk of aging. But over my 45 years, I've observed a distinct pattern. A struggling pancreas disrupts the autonomic nervous system, which in turn causes serious glitches in your body's ability to manage its temperature. These symptoms are often most pronounced between 10 p.m. and 2 a.m. You might be in bed with freezing hands and feet, yet your face feels like it's burning up. If this happens at least 3 times a week for more than 3 consecutive weeks, it's a significant red flag. What is so baffling is that you cannot measure these temperature swings with a normal thermometer. On the outside, your core temperature remains normal, but inside, dangerous changes are already underway. The pancreas is responsible not only for digestive enzymes, but also for regulating blood sugar. When its function is impaired, it causes a chaotic and random contraction and expansion of blood vessels. This is what disrupts blood flow to your extremities, making them cold. In response, your central nervous system tries to compensate by overheating the upper part of your body. This is markedly different from menopausal hot flashes, as it typically doesn't involve heavy sweating. And unlike simple circulation issues, warming your hands and feet doesn't bring lasting relief. If you're having these symptoms, start tracking. Measure the temperature on your forehead and on your fingertips at the same time each day, especially 2 to 3 hours after a meal. This could be the first whisper from your pancreas. The second alarming signal is a very subtle vibration in your abdomen, especially just before you go to sleep. This is one of the signs that almost everyone ignores. But ignoring it now could mean missing your only window for early detection. Most people mistake this sensation for normal gut peristalsis or the rumblings of digestion. However, my long-term observations show that when a tumor begins to form in the pancreas, it exerts microscopic pressure on the surrounding nerves and blood vessels. This creates a very specific vibrational pattern. This vibration is most often felt just below your solar plexus, about 2 inches below the point where your ribs meet. As you lie quietly in bed, you might feel something akin to a phone vibrating silently inside your belly. It's a faint, irregular tremor. It usually lasts for 10 to 30 seconds, disappears, and then returns a minute or two later. This has nothing to do with the normal activity of your intestines. In fact, this vibration can become even more noticeable when you are hungry. The key difference is this. If you press on the area, the vibration does not stop. If it were simply your intestines, the pressure would likely reduce the movement. But this vibration, caused by the tumor disrupting blood flow and creating unstable currents inside the vessels, is not influenced by external pressure. You'll feel it most acutely about 3 to 4 hours after dinner, when digestion has finished and your intestines are at rest. That is the moment of quiet when this signal becomes clearest. If you experience these vibrations more than 4 times a week for over 2 weeks, you must consult a specialist. To detect this, lie down in a quiet place, take a deep breath, hold it for a few seconds, and focus all your attention on your lower abdomen. Place your hands about 2 inches below your solar plexus and just observe for 5 minutes. You may notice subtle changes you've never felt before. The third signal is a sudden aversion to the smell of food. Imagine a food you have loved your entire life suddenly begins to disgust you. This is especially true for fatty dishes, meat, and the smell of fish. Now, your pancreas produces the enzymes needed to break down these very foods. When it starts to fail, your body instinctively rejects the things it can no longer process. What's crucial to understand is that this revulsion arises from the smell alone, before you even take a single bite. The mere aroma can trigger nausea, a gag reflex, and sometimes even a headache or dizziness. This happens because hormonal changes originating from the pancreas directly influence the olfactory center in your brain. As your digestive function deteriorates, your body activates a self-defense mechanism, forcing you to avoid foods that would cause it harm. This often becomes most apparent in the morning while preparing breakfast. A smell that was once familiar and comforting suddenly becomes unbearable. If this aversion to food is coupled with the temperature imbalances or abdominal vibrations I mentioned, it is an extremely alarming sign. If these feelings last for more than 2 weeks and are accompanied by any weight loss, please see a doctor immediately. The fourth signal is a distinct change in the smell of your sweat. This might sound strange, but please hear me out. Your body odor is not just a matter of hygiene. It is a critical indicator of your internal health. When something is wrong with the pancreas, its ability to help filter toxins from the blood is compromised, which in turn changes the very composition of your sweat. A new, unusual smell appears, often described as sweetish and sour, sometimes with metallic notes. This happens because of disruptions in insulin production. When your blood sugar level is unstable, your body begins to break down fat for energy, a process that releases substances called ketones. It is the ketones that give your sweat that peculiar sweetish smell. What's even more important is that this is often first noticed by those around you. Family members might start to comment on an unusual odor, asking if you've showered. The scent is present even without physical exertion or heat. It's persistent, and even after you bathe, it can return within a few hours. This isn't a skin problem, it's a change coming from your blood. The odor is often strongest at the nape of your neck, under your arms, and between your toes. If your body odor changes sharply, especially if it becomes sweet and sour and persists for more than 2 weeks, it is a reason for serious concern. And the fifth and final warning signal is an unusual stiffness in your knee joints. This is perhaps the most unexpected symptom, the one almost no one connects to the pancreas. Typically, knee pain is blamed on aging or arthritis. However, when the pancreas is malfunctioning, inflammatory substances can spread throughout your body via the bloodstream and settle in your joints. The knees, being among the largest joints in the body, are often the first to react. I remember a patient, an active man who had never had knee problems. Suddenly, he began waking up every morning feeling as if his knees were frozen solid. At first, he blamed the weather and used pain relief patches, but the symptoms only worsened. A full examination revealed an early-stage pancreatic tumor. Because we caught it, he is now successfully undergoing treatment. This stiffness is different from arthritic pain. With arthritis, the pain often worsens with movement, but with this pancreas-related issue, the feeling of stiffness can be present even at rest. It's especially pronounced in the mornings. Upon waking, it can feel like your knees simply won't bend, and it may take 10 to 15 minutes of moving around to loosen them up. What's particularly alarming is if this stiffness appears in both knees simultaneously. A typical injury affects one joint, but when the inflammation comes from an internal organ like the pancreas, it often affects both sides. If this lasts for more than 2 weeks and is accompanied by any of the other signals we've discussed, please see a specialist without delay. Now, as I promised, we come to the most important part. What specific examinations can actually detect this disease at its earliest stage? The standard tests often find pancreatic cancer only when it's already advanced. However, the early detection protocol I have developed over my career allows us to spot even the most minute deviations. First is a specialized blood test. Standard tumor markers are useful but not sufficient. I strongly recommend checking specific enzymes like elastase-1 and chymotrypsin, as well as inflammatory markers like CRP and ESR. These indicators can reveal the very beginnings of pancreatic dysfunction. Second is an endoscopic ultrasound, or EUS. A standard ultrasound from outside the body doesn't provide a clear view of the pancreas. But with an EUS, a tiny ultrasound device on the end of a scope is guided down to get much closer, allowing a doctor to see changes as small as a single millimeter. Third is a special type of MRI with contrast called an MRCP. This allows for a highly detailed view of the pancreatic ducts. It can reveal a narrowing of the ducts long before a tumor even forms, allowing for preventative treatment. And finally, I want to share a few preventative methods that truly work. First, control your water intake at specific times. The common advice to drink water evenly throughout the day is mistaken for pancreatic health. It's vital to consume about 40% of your daily water between 6 a.m. and 8 a.m. This is when your digestive enzymes are most active and your body needs the fluid. Add a slice of lemon to warm water to help maintain an alkaline environment. Conversely, drastically reduce fluid intake after 9 p.m. Drinking late forces the pancreas to work overnight when it should be resting. Second, perform a gentle abdominal massage 30 minutes before bed. Using 4 fingers, massage the area about 2 inches below your solar plexus in a clockwise direction with moderate pressure for 3 minutes. This simple act helped one of my patients completely resolve her chronic indigestion in just 6 months. Third, practice a specific breathing technique. Instead of just deep breathing, practice pancreatic breathing. Inhale through your nose for a count of 4. Hold your breath for a count of 7, and then exhale slowly through your mouth for a count of 8. Do this 10 times, especially about 30 minutes before a meal. It helps prepare your body for digestion. The most important thing I can tell you is this: do not lose hope. Pancreatic cancer is not a death sentence if it is found in time. Over 85% of my patients whose illness was detected in its early stages have made a full recovery. Starting today, I urge you to listen to your body with a new level of awareness. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.